My name is Usal. I'm a board certified plastic surgeon. Okay, failed breast reconstruction is one of the things that we really don't like to see. Unfortunately, it does happen because the breast cancer treatment is not a simple medical treatment. It has many different options: chemotherapy, radiation therapy, and so on. And also, many patients, they have other medical problems. Putting all these things in one basket, some patients' procedures, they don't come out with the way that we want to see. So failed breast reconstruction is an issue that we deal with, and we see it, of course, from our patients or also from other doctors' patients. This is something that in the population we see around 2 to 3% of the entire reconstructive procedures. When there's a failed breast reconstruction, there are a few things to deal with it. One of the failed breasts that we need to do something about this and make it better again. Also, a lot of help to the patient that going through these difficult times. So there are two aspects of this problem. One is surgical aspects, one is the emotional support to the patient. We have patient support groups that we are intimately involved with. Many patients find a lot of emotional help from these groups and the breast surgeons that we work with. Also within our own practice, we have support for those patients. We also get inquiries all around the world coming to us from other centers, patients who did not have a satisfactory outcome from their breast reconstruction. We provide them many different options. We can have different autologous, means patient's own tissue reconstruction, or sometimes whatever is reconstructed, we may need to revise and make it better. This can be from a simple procedure of scar revision and fat injection with liposuction and fat harvesting and fat injection to the breast, to whole spectrum of a new microsurgical reconstructive procedure to replace the unsatisfactory outcome. The surgery day always is very tough for the patient. Emotionally, they are very stressed out because they already have one failed and they're always worried about, is this going to be another failure? So reassurance of the patient that outcomes will exceed their expectations, that is part of our job. And we try to keep them comfortable, stress-free, and try to make this as comfortable and as easy as possible for them. Many of these procedures, unless it's a microsurgical reconstructive procedure, is an outpatient procedure, so they don't need to stay in the hospital. So they come in, they have their procedure done, and they will go back home, again pain-free, because we use, again, nerve blocks to make sure that this patient's postoperatively, they don't experience the surgical pain for the immediate postoperative period. Both in the short and long-term outcomes for this revisional breast reconstruction cases, of course, these are not going to be one-stage procedure because the patient already had one procedure not satisfactory outcome. So we need to make sure that they get the outcome that they are expecting. This means that sometimes we may do multiple little procedures to get to the point where we are. So patients know about this. Basically, this is a discussion that we have in advance. They are well aware of the plan, so they are not surprised with the results. And they will know that in maybe 6 months or so, we will reach our goals, what we may need to do more than one surgery to get there.